Just to get things going here, my name is Jason Onesto. I am the Assistant Director of New Student Programs here at the University of Richmond. Thank you so much for joining us for the next episode in our new Spider Summer webinar series. I'm going to hand things over to Marianne to introduce herself really quickly.
Hi, y'all. My name is Marianne Packer. I'm a recent graduate from the University of Richmond. I was actually on the pre-med track myself, and now I'm working in the Office of New Student Programs as an intern. Excited to be here with you today.
And before we hand things off to our guest today, if you look at the bottom of your screen, you'll notice that there is a question mark in a little box for you with Q&A written at the bottom. If you would like to utilize this function to submit any questions that you have throughout the presentation, we will have some scheduled time at the very end to answer any questions that arise. So you can either submit them as you have them, or you can wait till then to submit whatever you maybe was came up for you. But I think as long as we've got that out of the way, I'll hand things off to Dr. Vaughan. Dr. Vaughan.
Okay, thank you. So good afternoon, everyone. Um, I know that you all are really excited to start college in the fall, and I look forward to working with you all on the pre-health track. Um, and thanks for taking the time to attend this webinar. I know you've got a really busy summer ahead of you, but there's some important information that I just wanted to share with you about pre-health studies and planning for your fall semester courses. So again, I'm Dr. Vaughan. I'm a member of the biology department at Richmond. I serve as the primary health professions advisor on campus and oversee the pre-health studies program. And I have the pleasure of working with the many talented students and alumni that we have who apply to professional schools, like one of them you've already met, Marianne. So what I wanted to do is just give you a sense of what to expect with pre-health studies. I thought I might begin with just this graphical slide here to reinforce the idea that it's a really great time to be considering a health profession field for your career because it's an area where there's a lot of strong job growth right now. And this chart is actually based on data that was taken from the U.S. Department of Labor, and it shows just a few years back, the healthcare sector became the largest employment sector in the country. It surpassed retail, manufacturing, and the business services. So that was around 2022 that it did that. Okay. So you're going to benefit from this explosion of growth in the job field in the entire health sector. So at the start of the semester, I'm going to be holding a more formal orientation meeting for students where we kind of go through the resources of the program in detail. But for today, what I wanted to focus on was more just general information about the program and giving you some guidance with regard to choosing fall courses. Since we are in the webinar format, I won't be able to see or hear you, but as was mentioned earlier, you can post questions using the Q&A function. We'll try to watch out for those as we go through. We can certainly take questions at the end as well. Okay. I did want to clarify what pre-health studies is and what it is not, because there's sometimes a point of confusion there for new students. And so what the program is a resource that will support all pre-health students at Richmond. And by pre-health, I'm referring to anyone who is pursuing a health profession career. And I underline the words here, all students in any kind of health profession, because sometimes students think that I only work with persons who are pursuing medical school, but pre-health includes the entire spectrum of health professions. So we certainly have a lot of, people who are looking at physician assistant programs, physical therapy, nursing, et cetera, dentistry. So all of that falls under the pre-health umbrella. The donut chart here that you can see gives you an idea of our applicants to health profession schools. This was from 2024, just to give you a sense of the distribution of interest that people have. So the dominant one is, yes, still medicine, but the others have been growing, I would say, in recent years. Okay. Second aspect that I wanted to emphasize here is that although the Pre-Health Studies program is housed within the School of Arts and Sciences, it is open to all undergraduate majors and students in all schools on campus. Okay. So I've provided for you here a list of the academic majors for the students represented in that donut chart who applied a couple years ago to professional school. And you can see that it's a really diverse group that includes the humanities and social sciences in addition to the natural sciences. But we also have students from the business school and leadership studies schools who are part of the program too. One thing you do not see in this list of majors is pre-health studies. And that is because pre-health studies is not an academic major. Okay. So that's a really important point. So you don't major or declare a major in pre-health studies. You think of it as a resource to support whatever other major you're pursuing is. Okay. The second possible point of confusion is that we do have a department on campus called Health Studies. And that one is an academic program that you can choose to either major or minor in. And a lot of times there's a fair amount of overlap between pre-health studies and health studies students. So it's a very common major that I see. I see also a lot of combinations of health studies with other majors or minors in the students that I work with. But if you're interested in learning more about the health studies program, I would certainly encourage you to visit their webpage. Their curriculum covers a lot of really important topics for anyone going into healthcare. And so you learn a lot about healthcare delivery in the United States, healthcare policy, health economics, public health. So these are all really important areas to be thinking about. One of the main resources of the pre-health studies program is pre-professional advising. And as I mentioned earlier, I am the main health professions advisor on campus. And so I help students plan out their curriculum, their extracurricular activities, taking into consideration whatever, intended degree program they're pursuing, ensuring that they're positioning themselves to, be a competitive professional school applicant when the time comes. And then during the application year to professional school, I help students navigate the process through various workshops that I lead, as well as individual advising meetings. We address topics like, how do you complete common applications? How do you write personal statements? Prepare for interviews at professional schools? How do you go about choosing what schools you eventually apply to for those various health professions? So these are all things that we address during group advising and individual advising meetings. I can also connect students with alumni in various, health fields for mentorship or shadowing type opportunities. So we have a pretty broad alumni network at Richmond across the US, especially strong in healthcare. And, although it's not an academic major per se, pre-health studies, does have a curriculum in a sense that, there are certain courses that you would want to take with any particular track. And so I would be advising in those areas as well. If you haven't already found it through the pre-health studies website, you can find a nice curricular chart that has all of the common courses that are required by professional schools for the various pre-health tracks. And I indicate on that chart the corresponding classes at University of Richmond. That same information is built into our system that we call Grad Tracker, which is part of the Bannerweb system, where you can go about, planning ahead for future semesters in terms of classes you want to take. And so that's a good way to keep track of your progress as well. So with that introduction to what health studies is and what it's not, and I told you a little bit about advising, I wanted to turn my attention to registration for the fall. so your first semester scheduling. Um, because you may be wondering what you should take or not take, as an incoming pre-health student. Um, so there are a few things there I wanted to mention to you. Okay. Um, the most important thing that I can tell you is that uh, taking one science course at least would be really helpful. Some students choose to take two, but I would say at least one. Uh, and that holds true regardless of what you're thinking about for a potential major. Okay. Um, so if you know now which direction you're leaning in terms of a major, then that might direct you a little bit more toward one course versus another. And I've given some information about that on this slide. So if you're thinking maybe biology or biochemistry and molecular biology would be something you would probably pursue, then the two classes that you should keep in mind there are biology 199 and chemistry 141. Um, in terms of physics as a potential major, we have a calculus-based physics course that students take called Physics 131. Um, and if you know at this point that study abroad is something you would very likely do at some point during your college experience, and by study abroad, I'm talking about a semester abroad versus as opposed to a summer abroad. If that's something you're really thinking seriously about, then I would suggest when you create your preference plan for your courses that you prioritize the Chemistry 141 class. Because the chemistry courses uh, are taken in a particular sequence, and there are a good number of them. I would say for most of the pre-health tracks, you're taking more chemistry than you are any other subject. So that would be a logical choice to start with if you were looking at a future study abroad situation. Um, uh, it's fairly common for students who have strong science backgrounds to start in their first semester with two science classes. Uh, if you choose to do that, I would just say be careful with your overall course load because the science courses do have a 3-hour lab each week. So that does take up, considerable amount of time. So that's just something that you can be thinking about there. Okay. Something else I wanted to mention here on the first semester schedule has to do with AP and IB credits that you may have received. Um, on the New Spiders webpage, you'll find a chart that I'm showing here that has information about how AP and IB credits are applied toward University of Richmond coursework and the corresponding scores you need for that. So this chart includes biology, chemistry, and physics courses. And when you're deciding whether or not to use the AP or IB credit for one of those subjects, it's important to know how that health profession school down the road, when you actually are applying later on, how their policies are going to relate to AP and IB credit for anything that they may require. So that is to say, just because University of Richmond considers these courses to be equivalent and gives you credit for them, it doesn't automatically mean that a professional school that you apply to later on will have that same view. And so fortunately, what I would say, the majority of professional schools that our students go to tend to accept these credits in terms of the biology, calculus, non-science courses, uh, mostly physics. There are some schools that will not accept the physics the way we do it in terms of like the AP IB. So I would say that's something that we would need to take a closer look at if you have AP credits or IB credits for physics. And especially if you're pre-med, we'd want to take a closer look at that to determine whether it makes sense to take the physics at Richmond or not. If you do have one particular area that's more likely to cause concern, it would be chemistry in terms of AP or IB credits. Uh, and so my general thought with this is that it's probably better not to use AP or IB credit for chemistry unless you know coming in that you would take more advanced chemistry courses later on to make up for that. So there are enough professional schools that have hangups about AP and IB credit for general chemistry that it's probably a good idea just to take the course here unless you know you're going to be a chemistry major or a biochemistry major even, and be taking more advanced level chemistry courses beyond what the professional schools would require. Okay. This is the chart that I mentioned a moment ago that is posted through the Pre-L Studies webpage. If you'd like to go there, you can see the most recent version of it. I keep it up to date there. Uh, so the primary take-home message for you today is that the Pre-L Studies program will support you along your journey toward a health profession career. And you can reach out to me at any point when you have questions or concerns about the Pre-L track. I'm here to help you. I've got my contact information on this slide here. And I will stop there to see what questions we may have. Okay.
Awesome. Thank you so much, Dr. Vaughan. That was some great information for our incoming students. So far in the Q&A box, I have one question, and for everyone online, please feel free to add more as you'd like. So our first question is, if I'm doing the SMART program, taking biology and chemistry, what other courses are suggested for pre-health students?
So what I would say for the SMART program is that the courses that I had listed earlier, the biology 199 and the chemistry 141, are rolled into that SMART program sequence. So those courses are replaced by SMART. SMART would be a year-long sequence. So essentially you're getting equivalent credit for the biology 199 and the chemistry 141 through that. And most students would not want to add another science course on top of that, especially in the first semester, because it is pretty rigorous in terms of the way that it's taught. So in fact, the majority of students that I've seen, they do the SMART 1 and 2 courses their first year, and then they start back up with like organic chemistry and the next level biology, which is the 200 level course in the fall of their second year.
Yes, and I was actually a SMART student myself. And to answer that question as well, I think there are some other sort of accessory pre-med or pre-health type classes that aren't STEM heavy that you could take. So any health studies course, if you're interested in that, might be good. If you are pre-med, some of the programs require or suggest that you take psychology or sociology. So some of those classes might be helpful to take during that time, but they're not as heavy with lab coursework. And I'm looking through and I don't see any other questions here yet, but we'll give everyone a moment.
While we
Dr. Vaughan,
give
is there
them,
anything
yeah,
else, you'd like
yes,
to
yes.
share?
While we give them a moment to think about that. So I am preparing to send out an email later this week to all students who indicated on their common application an interest in pre-health. So if you are not sure whether you made that indication on your Common App and you do not receive an email from me by Friday of this week, please email me and let me know so I can add you to my pre-health email list. And that way you'll be sure to get information about the orientation meeting that we're going to have the first couple weeks of the semester once that gets started. I also will have a Google form for you to complete to record your interest in the program.
Thank you, Dr. Vaughan. We had another question come in. What opportunities does UR provide to help with finding summer internship or shadowing opportunities?
Yes. So one thing I'll mention there is we have a great career services office. Um, and the Career Services Office runs a number of events during the school year. So one is called Deconstructing Health, where we bring in panelists representing various health professions and careers for it's usually a Friday or a Saturday event that runs for like maybe 3 or 4 hours, where you can connect with people in those fields. Um, we also have a LinkedIn site for alumni, a career connection site, where you can search for alumni across the US in any particular field of interest. Um, Third point there would be that I have my own personal list of alumni that I stay in touch with across the US and can connect students with. As well. We have VCU Medical Center in Richmond, which is a large academic medical center, and they allow students to shadow on their facility. They have two different programs for shadowing, one through their anesthesiology department and another through their surgery department. Um, we have the largest free clinic in the state of Virginia down the road from us, and a lot of students volunteer there. A number of students are medical scribes there. Some even get EMT licenses or nurse tech licenses and will volunteer at the clinic with physicians and other providers. Um, there are probably at least 8 community hospitals, in Richmond that students can volunteer or shadow at. Um, so there's really a lot of options, I would say, in terms of being able to connect with clinical experiences in Richmond, and maybe even when you're on, breaks outside of Richmond, connecting with an alumni in whatever area you're in. So.
Absolutely. And to add to that, we actually just had our career services webinar right before this one, and that will be posted later this week. So if you'd like to hear more from career services and the opportunities that they have for students to engage and connect, please check our new Spider Orientation YouTube channel to see that. Also, another question came in. I want to major in psychology, but do a pre-med track to be a psychiatrist. Any recommendations for classes to take as a smart student?
Well, I would make one main recommendation there, which is the Psychology 100 course, the intro, is one that is helpful to take as a first year student. And that one does not have an associated laboratory, so you don't have to worry about the load being too heavy to take that class on top of SMART. Um, Psychology has a couple classes you have to do kind of as their core curriculum before you can take electives at the higher level. So it would be good to start with Psych 100, and then you can progress into the 200 level course, which is kind of the gateway to all of the upper level electives. Good.
Great. And then also, Dr. Vaughan, in our last career services webinar, we had a question from a student that asked, when should I start thinking about pre-med coursework? When should I start considering pre-health coursework? And I thought I'd bring that up now since you're here.
It's never too early, I would say. Um, Most of the tracks in pre-health have a good number of classes to fit in. And I would say, especially for students who are not intending to do a gap year between college and starting professional school, it's even more important to get started with those classes so that you don't have like really heavy loads later on downstream. So just spreading them out as much as possible, and that means starting with them, at the first year. So it's never too early to take them. Um, I would say it's a good idea at some point during the first year to have your 4-year plan. You know, not that it won't change, but it just gives you an idea of what's coming and how you can balance your semester loads and account for things you might want to do, like studying abroad for a semester.
And Dr. Vaughn, in that case, should students maybe sign up to meet with you so that they can look through or consider that 4-year plan?
Certainly, certainly. So that's a big part of what I do is individual advising meetings. You can sign up for an appointment to meet with me through the pre-auth webpage. It's also when I send my email, there's in my email signature, there's a link that you can use to go to my web scheduler as well. Mhm.
And then we just had another question come in. Will there be enough spots in these intro classes for us? And if they are full, how should we handle that?
Yeah. So we do a pretty good job in making sure there are adequate seats in those courses. And I mean, courses like 199, biology and chemistry 141 are largely going to be populated by first year students. And so there are multiple sections of those courses. Um, if you, for whatever reason, do not get a seat in a class, then what I would recommend is contacting the person who's listed on Bannerweb as the person who manages enrollment for the course, because they may be able to give you an enrollment override to be able to take the course. It's not just for pre-health classes, but I would say for any class you really want to take. If you see that it's closed, it's always a good idea to ask for an override, because sometimes seats get held back, or the person who's in charge of enrollment management for the course has information maybe that's not available on Bannerweb, that they have more wiggle room in the course than Bannerweb shows. Yep. There's also a wait list feature for some courses where you can add your name to the wait list, and the system will email you if there's an opening, if someone drops the class and you're next on the list. So.
All helpful tips for registration, which looks a little bit different this year. So most people should hopefully get some of the courses in the top 20 that they'll be ranking.
Yep.
Are there any more questions from our audience today? Thank you so much for participating. And thank you, Dr. Vaughan, so far for all of your helpful information and answers. If we're wrapping up here, I'm just going to go ahead and share a few QR codes with everyone. So here we have a QR code that goes to our new Spider orientation website. The schedule for orientation has been posted, so you could go ahead and look on there to know what to expect in August. We also have the link to our new Spider YouTube channel. All of our webinars are posted there. This webinar will be posted, so if you have any additional questions or if you just want to review some information, you can check on there. Also, here's a link to our new Spider Summer Series if you'd like to sign up for any more webinars this summer. And finally, you can follow us on Instagram to keep up to date with the most common things that are going on and be right on time with all of our webinars and whatnot. Thank you all so much for joining us today. Thank you, Dr. Vaughan, and thank you,
You all.
Jason. Hope everyone has a great rest of the day. Bye.